If I could ask everyone to please stand. And Reverend
Thank you,
John
Chairman.
Gerhardt, if you could join us in the invocation.
Love to. Would you bow your heads with me? Lord our God, we find ourselves once again in that time of year where the seasons change, the harvests are brought in, and we pause to recount our manifold blessings. On many of our dining room tables, we place cornucopia, the horns of plenty, baskets filled to overflowing to represent the abundance we enjoy in this earthly life. And in this nation, truly, we are a plenteous people, blessed abundantly with great freedom, health, and wealth. And we are grateful for our blessings, and we give thanks. We are thankful also for the privilege for serving the community in which we live. We are humbled and grateful for their trust in us to provide for them the very best in health care. So bless our efforts, we pray, our Lord, as we deliver their babies, as we bind their wounds, as we intervene with surgery, and as we help them to heal. And for those who are beyond our efforts to heal, may we administer the deepest of care and compassion for them and the families they love. Lastly, I thank you, our God, for each and every member of this hospital board who give freely of their time and their talents to guide this great institution of healing that we call Sarasota Memorial Healthcare System. Bless them and all our leaders with wisdom from above. These things together we pray and we give thanks. Amen.
Join me in a pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And thank you and welcome. I call this meeting to order. Before I get started, however, I have a public comment statement that I read at each meeting. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen's comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are limited their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposals, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Well, thank you. First order of business is to ask for a motion approving the orders of the day.
So moved.
Second.
All those in favor of the motion, please signify by saying yes. Yes.
Yes.
Opposed, no. Next up is I'll ask for a motion approving the minutes of October 21st, 2019 meeting.
Motion.
Second?
Second.
Okay, we have a motion, a second. Any corrections? All those in favor of the motion on the floor, please signify by saying yes.
Yes.
Yes. Opposed, no. Already. We have a board report regarding the election of board officers. First off, I'd like to have a motion for us to entertain election of the slate of officers, the board chair, first vice chair, second vice chair, secretary, assistant secretary, treasurer, and assistant treasurer. Do I have a motion?
So moved.
We have a second?
Perhaps we should read the slate?
Okay, okay. Well, no, all I was doing was asking that we were going to do the election. That's what I thought
There
our
you go.
motion needed to be.
Yes.
That's all I'm trying to do. So with that in mind, I turned it over to Greg. And
Thank you,
that's
Mr.
my
Chairman.
misinterpretation of what you had asked me for.
Under board reports, item 4 on the agenda. At this time, I'd like to move election of the following slate of officers for the 2020 board year. As chairman, Bill Noonan. As first vice chair, Jim Meister. Second vice chair, Sharon Wexler de Peters. As secretary, Britt Reiner. As assistant secretary, Tram Hudson. as treasurer, Joe DiVirgilio, and as assistant treasurer, Daryl Henry.
Thank you, Greg. And I apologize to the board. I should have asked for that first. I misinterpreted my script. So with that in mind, that's the slate before us. Do we have a motion to approve that slate?
Move.
And a second?
I'll second it.
Okay. Any additions, deletions?
Just a comment, if I may, Mr. Chairman. On behalf of the board, I'd like to thank you for your 2 years of sacrifice and leadership in guiding us through probably our biggest development period in the history of SMH. Outstanding job, Joe. Well done.
Thank you very much. Appreciate that. Alrighty. All those in favor of the motion on the floor, please signify by saying yes.
Yes.
Yes. Opposed, no? Well, thank you. Well, Jim, you kind of preempted my thank you. That's fine. I appreciate it and all that, but I do want to just take a moment here before I hand the gavel over to Bill to just really thank you guys as the board team. You're exceptional. There is no ifs, ands, or buts about it. Each of you have willingly taken on, well, at least publicly, taken on the various chairmanships out there, and that's really where all the heavy lifting takes place, and it makes my job and the board chair job very, very easy. In addition, David, Carol Ann, and the rest of the executive team, our job is to help work with you to set a strategy, but the true work is in the implementation of that strategic plan. And as a result of this year and the last 2 years, they have been exceptional. So thank you to that team, David, you and Carol Ann, for your guidance on the board. I congratulate Bill. Just those of you who don't know him, he's an executive, his former life as an exceptional executive, and he's going to bring and be able to take this SMH team to new levels going forward. So I appreciate that. So with that, Bill, the meeting is yours. Thank you, everyone.
All right.
So, thank you, Joe. I appreciate the vote of support. You both have stepped on me a little bit in terms of some things I want to say. I want to say about Joe, because Joe has been the chair of the board for the last 2 years. He's been on the SMH board since 2013. If you were to look at his bio, you would see a significant career, outside of his business life, a significant career in public service, all different organizations, United Way, et cetera. He was on the board of, St. Francis Hospital in upstate New York for 12 years, Joe. So a big tenure in terms of hospital board service. So thank you for that. If I could just take a few seconds to highlight some of the significant things that have gone on briefly over the last 2 years, and I could go on and on and on, but just to give you a flavor of during Joe's tenureship, SMH earned magnet nursing recognition for the 4th time. Less than 1% of hospitals have that. SMH received the highest 5-star rating from CMS, only hospital in Florida and one of just 52 across the nation to earn that rating for the 5th consecutive rating period. We were among the nation's top 100 hospitals by IBM Watson Health and included as one of the best hospitals by Newsweek. The Leapfrog Safety Report just came out, and again, SMH received the A rating, which we've done since the fall of 2016. You get the picture here in terms of all the significant things that have gone on. Earlier this year, we broke ground on several projects that will transform healthcare throughout the region, including the Cancer Institute on the main campus, the Radiation Oncology Center at University Parkway, and the new 110-bed hospital in Venice. And we also opened the new Lorraine Corners Medical Office Building. Again, all during this 2-year period as Joe as the chair. And on top of that, our graduate medical education programs expanded to serve our community, including the internal medicine residency program, which is now at full capacity with 39 residents, while the emergency medicine program welcomed its first class of 9 residents. And, oh, by the way, we continue to have a strong operating performance, including a 22% increase in adjusted admissions from 2017 to 2019, and a 24% revenue growth for the same period. So, Joe, our thanks to you for your leadership of the board over the past 2 years, and thanks for a job well done.
Thank you very much.
Very good.
You're gonna increase your pay.
Very good.
Well, Bill, I know you'll take it from that point and just take us to new levels too, so I appreciate that.
Okay,
Thank you.
thank you, Joe. So now back to work, right?
Back to work.
Okay, back to work. So next on the agenda is our physician speakers. So Dr. Schulman, I believe you have an introduction?
I do. We'll welcome Dr. Renuka Siddharthan from the Memory Disorder Clinic of University of South Florida, working to prevent Alzheimer's. Thank you. Welcome.
Good afternoon. I just want to talk briefly about the work of the Memory Disorders Clinic at our hospital system. The Memory Disorders Clinics were chartered under state legislature, did this back in 1985, initially with about 4 centers, and we're up to 16 centers. Our brief is to provide services, diagnosis, education, research for patients and families who are living with Alzheimer's disease and related disorders. This is significant for us in Florida. We have the second highest incidence rate of Alzheimer's disease in the nation, only behind California. We have about 560,000 individuals currently with Alzheimer's disease in Florida. And this, as population growth happens, is anticipated to increase to 720,000 individuals in a few years, in 2025. Right now, Alzheimer's disease is the 6th leading cause of death across all ages in the United States. A lot of work has been done in attempting to find a cure. There have been about 200 clinical trials which have been fruitless to date. And so everything is being looked at again with different approaches are being looked at. And what we now recognize is at this time, there is no cure. We are focusing on prevention and understanding the various factors, and they are multiple. It's not a single thing that results in the progression to cognitive decline and then to significant disease, namely Alzheimer's disease and other similar conditions. So we are now focusing on early intervention, early recognition, early intervention, and lifestyle changes. It is useful to look at cognitive decline across a continuum. We have age-related cognitive decline, which is understood and clearly delineated. And then beyond that, mild cognitive impairment, which is different and distinct from age-related cognitive decline, and then further progression where there is impairment in 2 or more cognitive domains affecting function qualifies for a diagnosis of dementia. So now the question is, when do we intervene to prevent or moderate the symptoms of dementia? Part of the work we do in terms of our role in research and education is outreach, community outreach and education, teaching people in the community about normal age-related cognitive changes, and then also sharing current state of the knowledge in terms of what has been shown to be beneficial in maintaining cognitive abilities and preventing decline. So we have a research information that we share, and we also help interested people access research studies and connect them with research initiatives that are in our near and more distant communities. And in this context, I do want to talk about computerized brain training, and this is sort of also referred to as brain fitness. And if you look at cognitive abilities across age, we see that in general, the line on the top with the open circles is vocabulary. That generally is maintained fairly well till pretty late into one's 80s. Most of the cognitive functions plateau around 55, 60, and then we can see a step off. The open triangles are numeric abilities. They fall quite clearly. Then comes the perceptual speed, which are the open circles. The spatial orientation is above that, and then inductive reasoning. So we have a sense of what falls first and what are the relative strengths with cognition as people age. So this is a study that we have partnered with the University of South Florida. It's called PACT, Preventing Alzheimer's with Cognitive Training. And we have shared information about this study with the community. The Memory Disorders Clinic has held 2 programs or 2 community outreach efforts to disseminate information about this study and its benefits. Patients or interested individuals in our community can access this study, and we're facilitating that through setting up enrollment at Blackburn Point locally. And then as time goes on, we expect that we will share the research information data that comes out of these efforts. So when we look at brain training, and in this context, I want to share that there's a specific one which is called Brain Fitness, HQ. It is a proprietary program. That is the one that has been studied. Most of the publications in this area have been in the last 3 to 5 years, so it's relatively new. And what is now understood from this work, and there have been 13 studies done on patients with no noticeable cognitive decline. That means people with age-related cognitive decline, perhaps, and 1 study with a group of patients with a diagnosis of mild cognitive impairment. And what has been shown is that this brain training translates to enhancement in everyday function. And when we talk about everyday function, it's the instrumental activities of daily living, which are well understood and quantitated. So patients who gain cognitively do show the greatest benefit in everyday function. And when the training gains occur, they are durable. And we also are trying to figure out the dose. As with any intervention, how much is the right dose and is more better. So when we look at the results to date, we have some information, which is a starting point. Patients or individuals do report health-related quality of life improvements, and this is a subjective measure that is being understood. Computerized brain training protects against decline at 2 years, and there is protective effect of all types of training at 5 years. And when we talk about training, we should distinguish between processing speed, programs that work on improving processing speed, which is the one that declines first and foremost as people age, as well as other modalities such as memory or reasoning. So if you look at everything, there is a protective effect. And we also see some benefits in preventing depression, which is also an important factor for cognitive decline. And then again, we see patients reporting an improved sense of control, which literature says is linked to improved health outcomes. So, to summarize what we know so far from the work that's been done, these a modality, cognitive training based on the computer, works in improving cognitive quickness, and this is processing speed, as well as attention. Attention, particularly divided attention, switching attention, ignoring distraction, all of this feeds through to improved executive function. So we have talked about improved everyday functional performance and improved brain function, and we also can quantitate the benefit of this work or these interventions by looking at the data for driving safety. We see about 50% reduced all-fault, at-fault crash rates at 6 to 10 years, and patients maintain driving autonomy, driving mobility at about 40% reduction in driving cessation at 3 to 5 years. Future directions, again, it's a question of when do we intervene, when is the optimal time to intervene. So case finding is important. Early diagnosis of cognitive impairment would put a person at the mild cognitive impairment stage. Most of these studies are looking at people without any diagnosed cognitive impairment. So the question becomes, does the strategy work best for maintenance, meaning to say before any cognitive impairment is evidenced, or can these also be applied to improving cognitive function in those who have already begun that slope down? So the goals of the studies are to establish a baseline and follow over a period of time, and then as part of our mandate from the Florida Department of Elder Affairs, provide research for both not just services but also access to research studies, education, and help and advocate for finding a cure. So that is my presentation. Any questions?
I have a question.
Sure.
Good.
What involvement or interaction do you have with the Roskamp Institute here in Sarasota?
We have liaison members coming over to our center and sharing with us their current studies, and we certainly refer patients who have an interest in clinical trials. So that is the connection we have with Roskamp.
Thank you.
Mr. Henry has a question.
Sure, thank you. Ma'am, I sure do appreciate what you do. Let me tell you, I have some personal experience with it. And I find that HealthFit is a big difference between training and testing. All I get when I go there is tested one more time. There's never been any therapy or training of any kind. I'd like you to look at, on your slide where you talk about the difference, talk about the difference, and think about the difference. They are significantly different. Walking in and running the same testing, again, is of real value.
And I think connecting
Certainly.
interested people and people at risk to this study, for example, at USF, helps us to set up that measurement, which seems to me what you're interested in talking about.
Okay, thank you. Any other questions? Yes,
What,
Doctor.
what is your opinion on all those little apps that we have available on our phone that say they're training our brain and improving our memory and, trying to fend off Alzheimer's? I know my husband uses them. Are they useful? Are they anything like what you're using?
Now, we're not using any of those ourselves in our clinic. Those apps do work for attention. As I shared with you, there's memory, there's attention, and there is, more importantly, speed of processing training. So the speed of processing training has been shown to be beneficial. Now, it depends on the app, whether it's built into do the speed of processing training and how that person gets the feedback from the app.
Pardon the interruption, I may have something for you on that.
Sure.
The main thing they're testing with those apps is reaction time
And indeed,
and some recognition, but mostly only reaction time.
and that has been shown to connect
Yes.
well to improved functioning.
And why don't you use it then?
We'll certainly take it back and ask the question, and many of those are proprietary, and that would be the limitation.
Thank you, Doctor. Thank you very much. All right, next on the agenda is Excel Award. David?
Thank you, Mr. Chairman. I would like to take a minute and introduce you to our November of 2019 Excel Award winner, Anne Marie Hansen. Anne Marie, come on up. Stand over here by me. Make me look good. The Excel recipient for November is Anne Marie Hansen, who is an environmental aide 2 in our environmental services. She has been a Sarasota Memorial employee since December of 2017. Anne Marie received many Excel nominations, and the common theme of all of them is that she is a stellar employee who is a vital part of the team. Her peers say she takes great pride in her work and goes above and beyond to make sure patients and employees feel comfortable. Anne Marie also is known as a great communicator. She speaks to both our charge nurse and bedside nurse when planning her day. Patients always compliment her on her positive attitude and efficiency. Anne Marie can be counted on to get the job done right the first time. She anticipates all the unit's needs and completes her task before she's even asked. Her attention to detail is outstanding. She never misses cleaning even the smallest spaces, and thanks to her diligence, she once even found a patient's wedding ring on the side of her chair. Marie, thank you so much for everything that you do. We appreciate it.
Congrats on your Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. You are a superior performer who makes an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Anne Marie, with the Excel Award for the month of November 2019. Signed by David Barrender, President and CEO, and Joe DiVirgilio, Chair.
Past chair now.
Past chair.
Hi. Thank you very much. It really warmed my heart to be appreciated like this, and I just feel so much support from my departments and from all the nurses on my floor, and it's just been wonderful to have this award, and I very much appreciate it. Thank you.
So next we have a Physician Excel Award for the fourth quarter. David?
I do, and I would like to introduce the board to our Physician Excel Award winner for the fourth quarter 2019, Dr. Rafael De La Puente. Doctor. Thank you. The recipient of the Physician Excel Award for the fourth quarter 2019 is Dr. Rafael De La Puente. Dr. De La Puente, also known as DLP, has been practicing emergency medicine in Sarasota Memorial's Emergency Care Center since July of 2014. Staff members say DLP is a highly respected role model for his excellence in patient care. He generally works during the busiest times in the ECC, but also remains calm and focused, displaying a positive energy that sets the tone for the department. DOP also takes the time to collaborate with staff to improve patient care and answer questions. Thanks to his love of teaching, nursing staff gain a greater understanding of the why behind his treatments. He's also extremely approachable and makes sure to compliment staff on their work. His dedication to his patients is second to none, and he's known for coming in early, staying late, and taking on complex cases, even near the end of his shift. Given his expertise, his inspiring attitude, and commitment to top quality care, staff members say DLT should also stand for deserving, loving physician. He truly fits that description. I got to thank you for everything that you do for us. Appreciate it. Okay? Britt.
Congratulations. Excel recipients are physicians who are recognized as role models of excellence. Superior in performance, they are leaders who consistently demonstrate a collaborative team approach in their work. These individuals strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in our community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognize you, Dr. Rafael de la Puente, with the Excel Award for the fourth quarter of 2019. Signed by David Verinder, President and CEO, and Joe DiVirgilio, the former chair.
Thank you so much. It's truly an honor to receive this award and be here today. I want to thank you all for supporting medical education and allowing me to be here. I actually graduated from medical school here, so it's truly an honor to be here. I wouldn't be here definitely with the support of my team and the people I work with on a daily basis. It's truly they work miracles in the ER to help save people's lives. So thank you all. It's truly a privilege to work with the Sarasota community, and I'm truly blessed to be here and being able to provide care for Sarasota. So thank you so much.
Very good, thank you.
So I just want to demonstrate real quick that that's a product of the investment we've made in our education here, because he, obviously, as he just said, went to medical school here on this campus, graduated, went to residency, and came back. So we appreciate that. Thank you.
Excellent, very good. So David, I understand we have a Hero Award as well.
We do, and you're correct. Okay. So I'd like to introduce to you our Hero Award winner for November 2019, Vanessa Ballard. Vanessa. So I have to tell you, I'm just going to fess up, all right? So I think as the board knows, we recognize our award winners at Management Council, and then we a couple of weeks later we come in and do it in here. So I got up in Management Council and read Vanessa's story, which is an incredible story here. But she did correct me on a couple of things. She goes, "Nope, that detail wasn't exactly right." And that so it was lovely. You were lovely, and it was a lot of fun. So I appreciate you being a good sport. Oh yeah. Okay. So I'm hoping we have the story right, but if it's not, just jump right in here again, okay?
It's long, but I'm sure it'll be fine.
It's not. It's a great story. So Vanessa is a physical therapist in our outpatient rehabilitation services. She was recently at the Y when a woman in a spin class collapsed and fell off her bike. Vanessa immediately jumped into action and controlled the situation, which was extremely serious. The person's breathing pattern had begun to slow, and soon there was no pulse. Vanessa and a friend of the individual immediately started CPR. They initially did not have a bag to provide breaths, so Vanessa provided mouth-to-mouth resuscitation without a barrier until a lifeguard arrived with an ambu bag. Vanessa led the effort to provide CPR, including keeping count of compressions and checking for a pulse. Her calm demeanor helped the bystanders who were assisting from panicking. Vanessa and the friend completed 8 cycles of CPR before EMTs arrived and treated the individual. Ultimately, the patient was breathing on her own when the EMTs left. Vanessa's quick thinking, expertise, and ability to lead the bystanders made all the difference to those critical moments before the first responders arrived on the scene. And she is a true hero, and we thank you for everything.
Congratulations on the Hero Hall of Fame. The hospital board and administrative staff of Sarasota Memorial Healthcare System hereby induct Vanessa Ballard to the Team SMH Hero Hall of Fame for actions that capture the essence of a true hero, including courage to have persistency in the face of fear, passion to always do the right thing, integrity to have a strong moral compass, and concern to have concern for the well-being of others. Signed by David Verinder, President and CEO, and Joe DiVirgilio, former chair. Congratulations.
Thank you. I actually had the lady who I performed CPR on come to the management council meeting, and I'm thrilled to say because of her care here at this hospital, she is 100% cleared, and she's actually back at spin class that we went together last Friday. So, yeah, she came to SMH. She couldn't say enough things about her hospital, from me jumping in at the Y to her rehab to the ICU. They were thrilled with everybody they encountered here. So I felt very proud to be part of such a great organization and to watch this woman go from lifeless on the floor, she'll tell you, and she's straight about it, to completely back 100% with no deficit. So to me, it's incredible. The statistics were against her, and the care here was outstanding. And I'm proud to live in a community where people come together and do the right thing. So thank you all for your support.
Thank you. Okay, next on the agenda is report of the medical staff. Dr. Schulman.
Yes, thank you. The medical staff has just started a new year by electing its leadership, and I believe Mrs. Wetzler de Peters has a motion confirming those elections.
Yes, I do. I move approval of the 2019 through 2020 Medical Executive Committee roster, including the medical staff officers and department chairs, as recommended by the Medical Executive Committee.
Okay, we have a motion and a second. Any discussion? All right, hearing none. All those in favor, please indicate so by saying yes.
Yes.
Yes. Any opposed? The motion carries. Thank you. Does that conclude your report, Dr. Schulman?
Yes, that concludes my report. Thank
All
you.
right, thank you. Next, the foundation report, Mason Ayers.
Thank you, Mr. Chair. First of all, I will look forward to seeing the hospital board at our upcoming Corinthian Donor Dinner. It's going to be held on December 5th at the Sarasota Yacht Club. The evening is a wonderful opportunity, for us to celebrate the generosity of our donor community, and I hope you all can make and join us for the dinner. Also, our plans continue for the upcoming hospital gala on January 11th. The event is shaping up to be a wonderful evening, to be able to highlight the great work that the SMH Cancer Care Services Program provides to our community. And that concludes my report, Mr. Chair.
Very good, thank you. Any questions for Mason? All right, thank you very much. Next is the secretary's report. Our new secretary, Britt Reiner. Britt?
Thank you, Mr. Chairman. Monday, December 16th, 2019 is going to be a terrific day. From 9 to 10:30, the Human Resources Committee meets. From 10:30 to noon, the Mission and Planning Committee meets. From noon to 12:30, there will be a closed session of the hospital board. From 12:30 to 2, we will have board lunch and an issue and financial review. From 2 to 4 p.m., we will have the board meeting. And then immediately following the board meeting, we will have the corporate compliance meeting ending at 4:30. That concludes my report.
Thank you, Britt. Okay, next on the agenda is the treasurer's report. Sharon Wetzler de Peters, our treasurer.
Yes, I have a motion. I move approval of the bad debts and charity care for the month ended October 31st, 2019, in the amount of $27,428,000.
All right, thank you. We have a motion and a second. Any discussion? All right, hearing none. All those in favor of the motion, please indicate so by saying yes. Yes.
Yes.
Any opposed? That motion carries. Thank you very much.
That does conclude my report, Mr. Chairman. However, as outgoing treasurer, it is my pleasure to hand over the golden pen to Mr. DiVirgilio. Welcome.
Very good, thank you. All right, next on the agenda is financial highlights. Bill Wojin, our CFO.
Good afternoon. Thank you, Mr. Chairman. So this October financial highlights represents the first month of our financial fiscal year. So I will not go over the fiscal year-to-date numbers since they're the same as the month. For total revenue for the system in the rating agency format, we had revenue of $87,414,000 compared to a budget of $81,828,000. Total expenses for October, $80,938,000 compared to a budget of $78,685,000. And operating income in the rating agency format for October, $6,476,000 compared to a budget of $3,143,000. Our operating margin for October was 7.4% compared to a budget of 3.8%. Moving on to statistics for the hospital, the average daily occupancy for October was 566 patients compared to a budget of 535 patients. Our average acute length of stay for October was 4.09 days compared to last year was 4.26 days. Admissions for October, 3,740 compared to a budget of 3,479. Surgical cases for October, 2,166 compared to a budget of 2,125. And in October, we had 382 births compared to a budget of 340 births. The outpatient registrations for October, 40,103 compared to a budget of 38,624. And between our two emergency care centers, we had registrations of 10,217 compared to a budget of 9,794. And for October, our case mix index for all patients was 1.78, and for Medicare patients, 1.8. Mr. Chairman, that concludes my report.
Okay, thank you, Bill. Any questions for Bill? Okay, very good, thank you. Next on the agenda are our committee reports. First up is the Governance Effectiveness Committee. Greg Carter, as chair. Greg?
Thank you, Mr. Chairman. As reported earlier, the Governance Committee met this morning after approving the minutes of the committee's November 21st meeting, and the committee discussed the board officers for the 2020 board year. At this time, I'd like to add a personal note of thanks to Joe for an outstanding job over the past couple of years as chair. Welcome, Bill, to your new seat.
Thank you.
And I think Britt did an outstanding job today as her first shot as secretary. So. Next, the committee discussed the board member preferences for committee assignments for the year, and those will be voted on at the December board meeting. The committee also discussed the community members of committees, all of whom were appointed for 2-year terms last year. As the next order of business, the committee discussed the board calendar, and at this time, I move approval of the board calendar for the 2019 board year as recommended by the Governance Committee.
Second that.
All right, we have a motion and a second. Any discussion? All right, hearing none. All those in favor of the motion, please indicate so by saying yes.
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 Any opposed? The motion carries. Thank you.
Following that discussion, the committee conducted its annual review of the performance of David Verinder, the system's president and CEO. Based on the outstanding performance of the system, highlights of which include substantial progress on multiple elements of the board's strategic plan, continued national recognition for high-quality care, record volumes, outstanding patient experience scores, and continued strong operating performance. Based on these indicators, as well as market data regarding compensation for leaders of a comparable organizations, I move approval of a 4% merit increase in Mr. Verinder's base salary as recommended by committee.
I second the motion.
All right, thank you. We have a motion and a second. Any discussion?
Yes, Mr. Chairman. As I discussed in committee, this bothers me not because I don't think that he did a great job because he did a superb job. And I do think he needs a recognized raise in pay. But basically, he is evaluated at the 75th percentile of accomplishment, which he meets or exceeds almost all of the time. And I personally believe that he should be compensated accordingly. I think he should be compensated at the 75th percentile. This 4% raise gets him almost to the 65th percentile, and that's bothersome to me. So if I vote negative, it's not because I don't think he's done a good job. It's not because I don't think he needs a significant raise, but because I think he is not being raised sufficiently. Thank you.
Thank you, Dr. Raymer. Any other comments or questions?
I might add, I totally agree with Dr. Raymeyer, 100%. And if I vote negative, it's because of that.
I will add that I was in the camp of wanting to see us recognize our CEO to even greater heights because we are a national organization with that standing. But I will be voting in the affirmative because I am excited to give him the raise and base salary that the rest of the board will be doing.
Thank you. Any other comments? All right, so I believe we have a motion and a second? We do. So with that, I'll call for a vote. Then all those in favor of the motion, please indicate so by saying yes.
Yes. Yes.
Any opposed?
Yes.
Yes.
So we have 2 opposed for the record. Thank you. The motion carries.
Mr. Chairman, can the record reflect that this was not a vote against his accomplishments,
Yes, we
but
will.
against the frugality of the board?
We will note that in the record. Thank you.
Next, the committee reviewed and recommended minor changes to those board policies that were up for review, including the board policies on travel and education, strategic planning, conflict of interest, executive succession planning, the decision-making process, the role of the board, and community representatives. And I move approval of the listed board policies, including the revisions, as recommended by the Governance Committee.
Second.
Okay, we have a motion and a second. Thank you. Any discussion? All right, hearing none. All those in favor, please indicate so by saying yes.
Yes.
Yes. Any opposed? That motion carries. Thank you.
And finally, the committee heard a report regarding the systems compliance program by its compliance officer, Lisa Totten. The committee discussed the system's robust compliance structure, including the oversight, education, monitoring, reporting, enforcement, and risk assessment functions. The system utilizes to ensure compliance with the multiple laws, rules, and regulations governing its operations in and as its plan to continue these for the next year. At this time, I move approval of the corporate compliance program as recommended by the Governance Committee.
Second that.
Thank you. We have a motion and a second. Any discussion? Hearing none. All those in favor of the motion, please indicate so by saying yes.
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 Any opposed? That motion carries. Thank you.
That concludes my report, Mr. Chairman.
Okay, thank you, Mr. Carter. So next on the agenda is the Finance Committee. Jim Meister, Chair.
Thank you, Mr. Chairman. The minutes of the August 19, 2019 Finance Committee meeting were approved. David Patterson, Associate Chief Nursing Officer, and Robert Altiero, Director of Clinical and Business Systems, presented a request to replace the information system used in the surgical suites and by anesthesiology. The proposed all-script surgical system will provide a single continuous patient record that, among other benefits, will eliminate double documentation and enhances reporting capabilities. The $2.8 million system is budgeted for $2 million for the year 2020 and $800,000 for the year ending 2021, and is projected to go into service in the second quarter for the year 2021. I move approval of the funding for the all-script surgical system in the amount not to exceed $2.8 million as budgeted and as recommended by the Finance Committee.
Second.
Okay, thank you. We have a motion and a second. Any discussion? All right, hearing none. All those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? That motion carries. Thank you.
Thank you, Mr. Chairman. Bill Volgen, our CFO, presented a proposal to amend the investment policies for the board-designated funds in order to permit limited purchases of BBB-rated bonds of domestic corporations, adding a 10% of BBB securities to the portfolios is expected to have a positive impact on the current yield with limited incremental credit risk. I move approval of the changes to the investment policies for the board-designated funds as recommended by the Finance Committee.
Second it.
Okay, we have a motion and a second. Any discussion? Hearing none. All those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? The motion carries. Thank you.
To continue, Bill Volgen, our CFO, presented a request for additional capital funding in the amount of $1,454,000 in order to incorporate the changes required by the City of Sarasota to building the parking structure at the Support Services Building. Bill presented the list of design changes required by the city's Development Review Committee, which resulted in higher construction costs not anticipated in the original project budget for the Support Services Building. I move approval of the addition to the capital budget for funding for the Main Street parking structure in the amount not to exceed $1.454 million as recommended by the Finance Committee.
Second.
Thank you. We have a motion and a second. Any discussion? Hearing none. All those in favor of the motion, please indicate so by saying yes. Yes. Any opposed? The motion carries. Thank you.
John Salt, our Director of Facilities Management, presented the ranking recommendations of the selected committee meeting held on October 25th, 2019 for the ranking of architectural and engineering services for the main kitchen renovation and expansion project. The committee ranked the top 3 firms as follows: Goodwin Mills, Garwood or Cawood, GMC, Gresham Smith, and Plunkett Rasich Architects, LLP. I move the approval of the rankings of the architecture and engineering firms for the kitchen project as recommended by the Public Selection Committee and Finance Committee.
Second.
We have a motion and a second. Any discussion? Hearing none. All those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? That motion carries.
Robert Santos, Director of Biomedic Services, presented a request to purchase 1,980 Baxter Spectrum IQ infusion pumps at a cost not to exceed $2,750,000 after trade-in of the current pumps. This purchase will provide infusion pump standardization for current hospital needs, as well as for the upcoming infusion pump needs of our Cancer Institute and our new hospital in Venice. I move approval of the funding for the purchase of the Baxter infusion pumps in the amount not to exceed $2,750,000 as recommended by the Finance Committee.
Thank you, Mr. Henry. So we have a motion and a second. Any discussion? Hearing none. All those in favor of the motion, please indicate so by saying yes.
Yes.
Any opposed? That motion carries.
Bill Volgen, our CFO, presented for approval the updated listing of recurring wire transfers and ACH and other payments for the hospital, which is done every year. Bill described the control mechanisms, both internal and external, which are in place to ensure only properly authorized transactions occur. I move approval of the updated list of recurring wire transfers and ACH and other payments to authorize staff to initiate and authorize them as needed as recommended by the Finance Committee.
Second that.
Okay, we have a motion and a second. Any discussion on that? Hearing none. All those in favor, please indicate so by saying yes.
Yes.
Any opposed? That motion carries.
This concludes my report, Mr. Chairman.
Okay, thank you, Mr. Meister. So, Joe, you did not tell me there would be this many motions today.
the one to warm you up really well today.
Thank you. I'm tired already. So next on the agenda is the President's Report. David Verinder.
Thank you, Mr. Chairman. I do want to say, before I get started with my report, I want the board to know that how grateful I am to be in this job and in this position, and how grateful I am for the kind words you had to say earlier today and again at this table. So it's a privilege to lead, it's a privilege to be in this, and I just need you to know that, okay? So thank you. Now, with that being said, I want to look at I'm going to start today with our organizational report card, and we have the same categories that we review every month with the community. In the service category, we have a goal of having 8 out of 10 of our likelihood of recommending our number of services greater than or equal to the 75th percentile. It did come in just a little bit short this month. We're at 7 out of 10, and I'll show you the detail around that here in a minute. In the people category, we have our goal of having our part-time and full-time employee turnover rate be 24% or less. I am happy to report that we're just under 24% at 23.66%. In the quality section, we have our infection prevention. Our goal is to have our standardized infection rate at less than 0.93. Given that the national average or expected is at 1.0, we are doing better than that at 0.71, so in the right direction there. And in the finance goals, you've heard our CFO give the report a minute ago. We have our goals have our operating margin, which is our budget, at 6.5% or higher. We are tracking higher than that at 6.8%. And in the growth section, we have our strategic growth goals. The first one is our inpatient admissions and observation outpatients being at 46,000 or higher. We are tracking higher than that at 54,000. And our outpatient registrations having a goal of 894,000, and we are tracking higher than that at 942,000. So as I said a second ago, we look at our likelihood of recommending in our 10 different areas that we take a look at. We like to have 9 out of 10 be at the 75th percentile or higher. We did have 3 areas that came in just short of that. However, all 10 did meet the national median score. So inpatient rehab facility came in a couple of points short. The emergency care center, both at the main campus and Northport, came in just shy of that as well. So as always, our teams are always have this as a top priority and are working on it. Happy to report, happens a couple of different times a year, Leapfrog issues their report card for patient safety. Once again, Sarasota Memorial received an A grade in that. It keeps our streak alive. Ever since we've been participating in the Leapfrog report, we've been able to keep an A score, which ranks or gives grades to 2,600 hospitals ranked across the country. And we're happy to continue to produce this. SMH's nursing home, our home care, earned the highest 5-star quality ratings. Sarasota Memorial Nursing and Rehab Center and Sarasota Memorial Home Care Team each received top 5-star quality ratings from the Federal Centers of Medicare and Medicaid Services. SMH's skilled nursing and rehab facility offers a variety of short-term and post-acute hospital and long-term care programs. It is one of the few skilled nursing facilities in the nation equipped with a specialized 12-bed respiratory unit dedicated to ventilator and tracheotomy residents. In partnership with Baycare Health System, Sarasota Memorial Home Care serves residents of the Sarasota, Manatee, and Charlotte counties. Local cancer patients and staff marked our Radiation Oncology Center's construction milestone. SMH recently held a special event to recognize progress in constructing the new Radiation Oncology Center on University Parkway. 60 cancer patients, staff members, hospital partners, and contractors inscribed the messages of hope on the wall of the facility's radiation vault. The center is scheduled to open in August of 2020 with 2 state-of-the-art linear accelerators designed to destroy cancer cells while leaving normal cells intact. We recently had our annual staff meeting, and in that meeting each year, we install our new leaders and honor some physicians. So this year, our Sarasota Memorial's medical team honored 2 physicians for outstanding service to the hospital and the community, and installed new staff leaders for the 2019-2020 year at SMH's meeting. So orthopedic surgeon Dr. Ronald White was awarded the Health System's 2019 Lifetime Achievement Award. And our own cardiologist, Dr. Chippy Naluri, was named the 2019 Physician of the Year. And of course, everyone already knows Dr. Alyssa Schulman was named our Chief of Staff, serving as the top representation of SMH's 1,400-plus medical staff members. So Dr. Schulman, our personal congratulations to you.
Thank you.
Magnet Conference recognizes SMH nurses. Last month, SMH was recognized at the annual Magnet Conference in Orlando for earning its 4th consecutive designation last November. Only 51 hospitals in the United States have earned this recognition 4 times, an achievement attained by less than 1% of all hospitals in the U.S. SMH is the only hospital in the region with magnet recognition. And Connie, I know you and Jean are both here. I say that? Connie's not here? Oh, you're right here. Okay. Yeah, what is everybody? Connie and Jean, I know that you both lead that with a passion every year, and we thank you for doing that. So thank you. So staff gain a new perspectives on disabilities. Sarasota Memorial's Diversity Council recently hosted Caring for Persons with Disability, What We Don't See, Patient and Clinician Perspectives Conference. This event was designed to help staff become more familiar with the needs of people with disabilities and related approaches to patient care. We appreciate Pam running that as well. Staff help everyone breathe easier. SMH staff participating in a recent Venice Chamber showcase shared helpful information about lung health and smoking cessation. November is Lung Cancer COPD Awareness Month, a time to get educated about lung health and 2 common diseases, lung cancer and chronic obstruction pulmonary disease, or COPD. So we had a reception that recognizes our past and current Excel Award winners. Dozens of winners of Sarasota Memorial's Excel Employee of the Month Award recently gathered for a special celebration to honor their service. The Excel program was established in 1986 by former hospital board member, Mr. Jim Tollerton, pictured at the right in the center, and also pictured right behind me. He continues to fund the program through the Sarasota Memorial Healthcare Foundation. Jim, we appreciate you continuing to do that each and every year. Thank you. So we pay tribute to veterans has long been an important part of the hospital's history. In 1954, Sarasota Memorial Hospital was renamed Sarasota Memorial Hospital. Sarasota Municipal Hospital, sorry, reread that, was renamed to Sarasota Memorial Hospital to recognize those who served in the 2 world wars. On Veterans Day, those who served enjoyed free cookies at SMH. In addition, Annette Gargano of the float team and U.S. Army veteran, pictured above, right center, continued her longstanding tradition of making rounds at SMH, distributing special ribbons and pens to veterans. So thank you so much, Annette, for doing that. It was a busy month this month. SMH takes the step in the right direction to fight in cancer fight. Team SMH was out in force earlier this month at the Sarasota Manatee American Cancer Society, making strides against breast cancer walk. The team raised about $15,000, and the organization also served as an event sponsor. We also helped fight hunger at Bowls of Hope. SMH's corporate volunteers helped staff the recent Bowls of Hope event benefiting All Faiths Food Bank. SMH has also served serves a cup at the annual fundraiser, and I do believe ours is usually the most coveted bowl of soup.
Sounds good.
Thank you, whoever laughed. Thank you, Connie. SMH Venice Construction continues to make progress. To date, construction includes installation of the following: 7,200 yards of concrete, or approximately 728 cement truckloads, and 750,000 pounds of rebar. Our topping out celebration will take place this spring, and we're scheduled on time for an opening in fall of 2021. So, Sharon, we appreciate you keeping us on track. Medicare open enrollment in an effort to help community make informed decisions regarding their Medicare coverage for the coming year. Sarasota Memorial has placed this informational ad in the newspapers and on smh.com. Medicare's open enrollment runs through December 7th. I would encourage anyone in the public to take a look at this ad, go to our website, ask questions before you sign up for a Medicare plan, to ensure that for both First Physicians Group and Sarasota Memorial are in that plan, and providers. And that is my report, Mr. Chair. I'm glad to answer any questions.
Okay, thank you. Any questions for David? Very good, thank you.
Thank you.
Great report. Okay, next on the agenda is any public comments. I understand that we do have a speaker. Is it John Minder? Is that correct? Do I pronounce your name correctly? John? And you have a 5-minute time frame.
All right, thank you.
Thank you.
Good afternoon, Hospital Board and Chairman.
Thank you.
My name is John C. Minder, and for the record, I am a registered professional engineer and a registered professional surveyor and mapper in the state of Florida. I have been a resident of Sarasota County for the past 39 years and a resident of the Venetian Gulf and River Club in North Venice, Florida for the past 3 months. I have been a professional businessman in Sarasota County for the past 32 years. I am here this afternoon to humbly, respectfully request your help in getting the mentally ill, chronic homeless, and homeless off of the streets and roads of all of Sarasota County and into processing, counseling, and treatment, which in my opinion is costing the Sarasota Memorial Healthcare System millions of dollars for the mentally ill, chronic homeless, and homeless, uninsured, emergency patient, uninsured patient care by Sarasota County Memorial Healthcare System, of which, in my opinion, a substantial amount of these dollars went to mentally ill, chronic homeless, and homeless, uninsured emergency patient care. This is a part of a presentation that was distributed to all of you through your administrative assistant. And I know that I will not have time to put any more of this in the board record, but I will be putting this prior presentation into the board record. I think you have all seen what this is costing all of us as taxpayers in Sarasota County. And in my opinion, we're never going to get the mentally ill, chronic homeless, and homeless off of the streets and roads of all of Sarasota County without processing, counseling, and treatment. And the thing nobody ever wants to talk about is all of the mentally ill, chronic homeless, and homeless in Sarasota County have an addiction. And if they don't have an addiction when they first go on the street, they very quickly adapt to an addiction because they have to cope with the harsh conditions on the street. I think this is a problem of all of Sarasota County, and it's my opinion we all need to work together to solve this problem. I have been trying for the past 5 years to get this on the agenda for a discussion by the Sarasota Board of County Commissioners, and I have been unable to do it. I have no knowledge of why they won't put this on the agenda. And what I'm here this afternoon is to ask the hospital board to put this on the agenda for a discussion. Have your president and CEO send a letter to the Sarasota Board of County Commissioners requesting that they put this on the agenda and address it. Whether they vote it up or down, that's their opinion, and let's find out what that opinion is, and so we can determine where to go on this problem. Thank you for your time.
Thank you.
Thank you.
Thank you for your comment. I appreciate it. All right, legal matters, Caroline Kalish, anything?
I have nothing.
Okay, thank you. Any other business? Hearing none, we stand adjourned. Thank you.